Still got a few people coming in, so I'll just move on. We've got quite a packed agenda this morning. Really this session is to introduce all of the exciting things that we've got planned as part of our membership offer here at the network for this year. So you'll be hearing from a number of members of the team as we go through the session this morning, just about all of the tools, resources, opportunities to get involved. So like I say, please do bob questions, thoughts, etc. in the chat as we go through. So I'm just making sure that most people have managed to get in. It looks like it's slowed down now. So I'm really pleased to hand over to Ben Shaw, who is a member of our steering group, just to do a short welcome before we get into some more of the detail. Thanks, Ben.
Yeah, thank you, Emma. Thank you everyone for joining. It's really, really appreciated. I'd really like to welcome you to the programme launch event for 25-26. We've got a really good list of schemes we're going to be working through this year, so I hope you enjoy the session and get some value from it. Please do make sure you ask any questions when the opportunities arise. Just very briefly about myself. My role is the Associate Director of Financial Sustainability at University Hospitals of Leicester. In my role, I'm responsible for the cost improvement programme in particular, as well as quality improvement, and I make a very good use of the benchmarking data that comes out of the network to help develop our plans during the year, and in particular been involved in the acute indicators project that you'll get to hear about, and I think that's really good that that's been refreshed. We make a lot of use about that during our planning process for the start of the year, so I really hope you find that update useful. So obviously we've got exciting list of items to work through today. Really like to say a big thank you to the NHS benchmarking team for pulling the agenda together and for all their hard work. It really couldn't happen without you. Also like to thank the members of the steering group. So as I sit as chair of the acute part of the steering group, where we get any acute members who are interested to join and give any feedback on the metrics and the data we work through, and that then feeds into the overarching steering group for the network. A really good dedicated bunch of people trying to make sure that we all get the most value out of the network as possible, but we're always open to feedback. If you think there's things we could be doing differently or would like to get involved, then please let Emma and the team know, and we'll be sure to try and do our best to do that. So I hope that you enjoy the event. Make sure you ask questions, get some value from it. You know, an hour and a half is a long time for very busy people at this time of year. So please just make sure you get value from the session, and obviously we'll take any feedback at the end. So I'll hand back to Emma, and I hope you enjoy the rest of the session. Thank you.
Wonderful. Thanks, Ben. Okay, so I'm just going to give a bit of a short introduction. For those of you that have just joined us, welcome. My name's Emma Bamber. I'm the Associate Director of our member programme and lead the team here that undertakes all of the benchmarking, delivers the tools and provides the support to our member organisations as part of that work programme. And I'm just going to take you through a little bit around kind of who we are, what we do, and just go into a little bit of detail around kind of how we come up with the programme and how you can feed in sort of before we dive into the detail of everything that you can get involved in this year. It's brilliant to see some familiar names on the session, and thanks to those of you that have popped your contacts into the chat. Please continue to do that. It looks like we've got some new connections in there as well, and I'm really pleased to be able to introduce you all to the work programme for 25-26, and we're really looking forward to continuing to work with and support our members and existing and new members over the next year. I've popped the network vision on the screen here for you, and this really drives everything that we do here at the NHS Benchmarking Network. I think given the landscape that we're working in and the changes that were recently announced, continuing that focus on utilising data and the power of connections and networking, and that focus on improvement is ever the more important. And it's our 30-year anniversary next year. So we've been around since 1996. We've seen a lot of change over that time, and we're really proud of the fact that we've been working alongside and supporting the NHS throughout that time, all with that focus on improvement and driving positive change through data and through benchmarking and through making those connections. Our vision is also underpinned by our values of excellence, respect and integrity, and again that drives everything that we do here at the network. So kind of before we dive into the detail of what we have available to our members this year, I just wanted to give a brief overview of kind of how we develop our programme of work, and Ben alluded to that in his introduction, and kind of how we develop that programme of work that is funded through those membership fees. So everything we do here at the network is governed by our steering group, who are elected member representatives from our member organisations. And you can find out more about our current steering group representatives on our website. I think one of the team is going to pop a link where you can find out more in the chat. But they really do support us in kind of driving forward, kind of where we want to take the network, what our focus should be, what's important on the ground to be able to make those improvements. Kind of feeding into that steering group, we have 4 sector-specific reference groups, and you can see those on the screen there. So we have acute, a community, an ICB and an MHLDA reference group. Each one of those is chaired by a member of our steering group. So Ben is the chair of our acute reference group, so really involved, and those reference groups really give an opportunity for members of the network to feed in, to provide a voice, to support us in terms of kind of the types of metrics that we collect, how we can interpret them, how we can support you best, and to provide feedback, advice and guidance. And they really do help us to shape kind of how we deliver, how we work, and the areas of benchmarking that we undertake. If you would be interested in joining one of our reference groups, please do get in contact. Again, I think we're going to pop our email address into the chat, but we're always welcoming new members onto those groups because they really do support us in steering everything that we do. And we do really pride ourselves on being driven by members, for members, and alongside sort of the steering group and the reference groups, which are the sort of more formal kind of feedback mechanisms, we do have lots and lots of other ways that you can feed in. We run many kind of project specific focus groups where you can get involved around certain elements. So we have a really buoyant pharmacy focus group, for example, who support us in terms of driving that project forward. But again, if there's anything that you would like to kind of set up or get involved in, please do let us know. There are some of the more kind of informal ways as well of sending feedback in, all of which we kind of take into consideration as we start to develop the programme for the year ahead. So you can contact the project team. All of our contact details are available on the members area. Each of you will now have a dedicated membership contact, and I'll go through that in a few minutes as well, who can support you. We do surveys at the end of each project cycle to get some kind of granular level of detailed feedback on how those projects have gone, how we can improve. And we also have our annual members survey, which again, I think we're going to pop into the chat, which is one of our kind of key ways that we get kind of a wide range of views of how the network is supporting members throughout the year. And even through our technology, you can get in contact as well. So there is a feedback button on the members area. So if you're looking through some charts or a report and there's something that you just want to feedback, there is that option to get in touch with us there as well. And I guess throughout these sessions and the webinars and lunch and learns and things like that, there's always an opportunity for you to feed in and support us into developing what we do for you. So I just wanted to take the opportunity really to kind of go behind the scenes a little bit really and introduce our network support team. So I'm going to ask the team, they're really pleased about this, to put their cameras on just so that you can see the team in person. All of our member organisations will now have a named membership contact, one of the team who is there on hand to provide support, guidance. Please do get in contact with them if you do have any issues or any feedback or want some additional support. They are on hand to do that for you. We've got a whole host of colleagues. They're all on these slides here. We've popped on which projects that they're looking after. I won't go through these one by one. We will send the slides out. They will be available. But you can see that there's a friendly bunch of colleagues on the call and available to you as we go through the membership year. And I just wanted to flag some members of the team that you might not have come across before as well, but also provide amazing support guidance to us. We have Roma, who leads our team of analysts, who again support in terms of interpreting the data, providing that insight and additional support. And we also have our team of technical experts led by Jess Grantham, who build all of the tools that we use both internally and that you interact with in terms of being able to interpret that data. And we've got some really exciting developments coming this year with our technology, and David will be here later on in the session to talk you through some of those. So I'm not going to embarrass the team anymore with putting their pictures on the screen. So I will come off those and I am going to hand over to some of the team to talk you through the elements of the programme for this year. Thanks.
Thanks, Emma. So I will get started with just giving an introduction to the work programme from this year. My name's Rosie, I'm one of the senior project managers, and myself, Sarah and Joe will go through kind of some of the projects and opportunities that are on offer. So this first slide here shows kind of the breadth of the offer for this year. You can see that there's lots of activity going on, lots to get involved with, from kind of our data collection projects. We have our annual projects, which are kind of the circle around the outside. We also have our indicators projects, which Ben has already alluded to. So MHLDA indicators and community indicators are both collection projects. Our acute indicators relies on publicly available data. And I hope people have managed to see that new kind of interface that we've released recently online, had a play with that and the valuable insight that is available there. We will then go next into some more detail about some of the sectors and what's available for the sectors that you work in. But one thing I did want to draw your attention to is our national indicators output, which is cross-sector. So for those that were familiar with our ICB benchmarker, this is a development on that offer. The team led by Joe and Roma have really put some great work into this, and it's now the feedback we've had is it's so useful and user-friendly for people who aren't analysts, but with that kind of analytical lens. What it looks at is kind of health, population, demographic figures, as well as kind of that healthcare provision. So just wanted to draw your attention to that. If anyone hasn't had the opportunity to have a look at it, we did host a lunch and learn a few weeks back, and the recording for that is available on the members area. So please do have a look at that recording. There's a lot of valuable insight in there. What else you can do with our national indicators tool is it pulls together data from lots of different sources. There's around 40 different data sources, and you can then correlate and link those metrics together to see what's going on for the area that you're serving. So what you're able to then do is compare the data from kind of our collection projects and our other outputs with kind of the healthcare and the needs of your population. So it does provide really valuable insight, and I do encourage people to go and have a look at that if you haven't had the chance already. I will hand over to Sarah to talk through what's on offer for acute providers. Thanks, Sarah.
Thanks, Rosie. And I'm going to start by talking about our monthly project, the acute indicators, that both Ben and Rosie have very kindly plugged for me in advance, but I'm just going to give a little bit of more detail around it. And it is that interactive dashboard that is available to English trusts. And it offers that concise insight into different areas. And because we pull it from nationally available data, there is no submission required from trusts. But by benchmarking it against all other acute trusts in England, the dashboard facilitates that deeper understanding of your trust positions. It can highlight both where you're doing really well in your strengths, but also where there's some of those areas for improvement. We also are facilitating and running the emergency care project this year, and this has run annually now since 2012, and it benchmarks various clinical areas, including but not limited to the type 1 and 2 emergency departments, AMUs, SDECs, and also those type 3 units. And aligned with the national initiatives to shift that healthcare away from the community and alleviate some of the pressure on the type 1 and 2 units, this year we are looking to expand our outputs around the type 3s. Our final one is my next one is the managing frailty. In the bed-based setting, and this is building really on the success that we've experienced from the managing frailty in the acute setting, which we'd run for, I think it was 10 years previously, and this project is going to build on that success and explore the different bed-based settings with the wider frailty pathway, and using the clinical case review for that deeper evaluation to support that patient outcomes and improvements. And we're very much still in the scoping stage of this project, so if any of our members would like to be involved, please do get in touch using the email address that Rosie shared earlier, because we really welcome that additional feedback. We've also got the National Cost Collection, which uses publicly available data, and what that does is it takes your data from the National Cost Collection and it summarises it in a useful and concise way, which allows you to see where there's to see your financial performance and also where there's areas for potential improvement. We also are running the outpatient service, and that we acknowledge that outpatient services vary widely across providers, from that whether that's the clinic size, the scope, to workforce structure or operational processes. And this project was really designed to bring clarity and insight by benchmarking some of the key areas such as access, capacity, workforce, and across similar outpatient services throughout the UK. And again, the team is currently scoping which specialties should be included in this year's project. So again, if you've got any suggestions, please do get in touch, because I'm sure the team will be really grateful to hear your thoughts to make sure that you are receiving what's useful for you and your services. We also have the pharmacy project, and this has also been running for a number of years at the network. And the main pharmacy data collection looks at that provision by acute providers, looking at pharmacy departments, their workforce processes, finance, and the interaction and involvement that they have across other services. And this project has very much been developed in conjunction with national stakeholders. And my final one is virtual wards, or hospital at home as it's sometimes known. And over the recent years, we've seen an increase in the implementation of these nationwide. And this project was very much developed in response to members' feedback, not last year, the year before, to address some of those gaps in the data and gather that comprehensive insight on virtual wards. And through the surveys, clinical case reviews, the project has been able to provide that unique 360 perspective on virtual wards. And now that we're in that second iteration of the project, we're going to build on that initial collection for a bit more of an in-depth analysis of those service models. And I think I'm passing back over to Rosie now.
Thanks, Sarah. Yes, I will now speak through kind of what is available to kind of community providers on the call. So you can see there's quite a lot on offer for this year. People will have noticed the sort of introduction / reintroduction of our adult all-age community services project. So last year we benchmarked the adult community therapies in our adult therapies project that we ran. And this year we're bringing that back under the adult all-age community services banner based on feedback in our community reference group. There are some services we haven't benchmarked that we used to benchmark in the community services project for those that do remember. And this, by rebranding the project, this will enable us to kind of think about what services are most relevant and what services our members are wanting to see benchmarked this year. So what you'll see is the addition of cardiac and respiratory. Now, this project is quite a high-level project. It will mainly focus on activity and workforce and some other contextual information. And that project is running slightly later in the year, as you'd have seen in the first slide as you arrived on the call. So if anyone is interested in helping us scope this project and thinking about what are the real drivers and kind of key areas we should focus on for any of those services, please do use the email provided to get in touch, and we'd really welcome your feedback and input, especially for cardiac and respiratory, where we're reintroducing those services and we haven't benchmarked them since 2022. Similarly, we are also introducing this year a Children and Young People's Community Services project. And this is bringing together two projects that we ran last year, our Children Community Therapies project and our Healthy Child and Children's Community Nursing. We know that often children accessing community services are potentially reaching and touching many of these services. And so we wanted to bring that together to be able to offer that holistic perspective. We really encourage people taking part in this project. We have got a lot of traction in this space. We know it is a big priority in healthcare to reduce some of the waiting lists for some of these services, and kind of health visiting being that linchpin for children accessing these services. We're hopeful that this project will offer you that holistic view. Community Indicators continues again this year, and for those that haven't taken part in it, we get a lot of feedback about the usefulness of this project. This pulls is a data collection, quite high level metrics touching a range of different areas from community, but it collects the data monthly. And what this enables us to do is to see a month-on-month comparison. So not only can you benchmark against peer organisations participating in that project, you can also see the trends that are happening for your organisation across the year. Are there pinch points? Are there certain factors that need to be considered? So I really encourage those that haven't had the opportunity to take part in Community Indicators yet to consider that. You can start taking part as and when you wish to. So please do reach out to the team if that is of interest, and we're more than happy to give you a bit more detail as well. Our district nursing project continues again for 2025. There are minimal changes to district nursing from 2024 in terms of our main data specification. We are making some adjustments based on feedback through the surveys and through kind of colleague interaction that we've had across the year. So thank you for those who have given that feedback. But what we will be looking to do is introduce a workforce survey, as we have in some of our other projects. We got the feedback from our members about how valuable and useful this is in giving that 360 view of a service. And as came out in the district nursing project last year, some of the workforce challenges that we are seeing facing district nursing, we hope that by offering that 360 view and offering that workforce survey, we'll be able to really pick apart some of those challenges. We are collaborating again with the newly named Queen's Institute of Community Nursing, formerly the QNI, on this project, and they will be collaborating with us on that event again this year to try and make sure we're really getting under the skin of that full picture of district nursing. As Sarah has already mentioned in the acute slide about the emergency care project, I won't go into that in any more detail, but just to encourage our community members to be aware that that is available to them as well. It isn't just an acute project. Our intermediate care project is running again this year, and it continues to go from strength to strength. It's built upon the National Audit for Intermediate Care, which I'm sure many will remember. and we don't expect to see many changes in terms of this iteration. We're building on the successes of last year, and we really encourage participants on the call to really take part in this project, as it helps to understand kind of patient flow within these systems, and especially for our non-provider members on the call as well, this really helps to look at the kind of holistic picture of what's happening between the acute and community spaces. As Sarah has already mentioned, we are rescoping our Managing Frailty project for this year to a more kind of in a bed-based setting, so bringing in that community provision. So this is a new opportunity for our community providers this year. So please do keep an eye out, get involved in the scoping of it, because it's a really valuable opportunity that is available. And finally, our virtual wards / hospital at home project, as Sarah's already mentioned, building on the successes of last year's iteration. Please do get in touch if you are interested and want to find out more. We got some really positive feedback on that project, so a great way to get under the skin of your virtual ward services. So thank you. I will hand over to Joe, who will talk through the offer for mental health providers. Thanks, Joe.
Thank you, Rosie. Yes, so we are continuing to kind of maintain the projects that we've run for quite a long time. The adults and children's young mental health projects have run for over 10 years, and they are kind of remaining relatively unchanged. The last couple of years have seen us add in those sort of neurodevelopmental services, so covering ASD provision and ADHD provision. And that will continue to kind of be one of the main focuses for the next year. And what those two projects look at is that kind of community provision, as well as that the inpatient provision in mental health settings. And we have really comprehensive participation in those across all 4 devolved nations. And we look forward to continuing to have that, hopefully. And then in terms of the mental health, learning disability and autism indicators collection, that is a much smaller collection when compared to those 2 larger annual collections. And that focuses on productivity. So it collects about 100-ish metrics, and then we're able to kind of retain about approximately 300 metrics in our online toolkit, where you can view that, and you can view that on through our members area. As Sarah's already alluded to, the pharmacy project this year has been expanded to include mental health prescribing as well, so mental health providers are able to participate in that. And the Learning Disability Specialist Services project, which has just concluded last week with an event, runs a little bit out of sync with the other annual collection, so that doesn't start until September, but registration for that collection is open now, and that looks at those services that are just designed to treat people with a learning disability, so there's real specialist services. And as Sarah and Rosie have outlined, there's also the virtual wards hospital at home collection, which is open to all ward types. In terms of the outputs from these from our projects, the first chief amongst these is the reports, and these include the high-level metrics, the really kind of key metrics that are identified through the collection, and you can see your organisation benchmarked against the full data set, and the reports also include these dashboards, as you can see on the screen here, which places you as your organisation as the little red diamond in kind of the mix of the full national data set, and includes that kind of transparent mean and median part there. And finally, the online project toolkits, which are available through our members area, where you'll be able to kind of interrogate that data a little bit more, so you can cut it kind of by region and benchmark it in a variety of different ways, which we don't always include in the reports. And you can see the full kind of return from the data collection. So as I've kind of said in the reports, that's that higher level stuff, but in the toolkits that are available through the members area, you can kind of see that full tranche of data. And I think I'm now handing over to Stan to talk about how members have used this data.
Just before we hand over, I'm just going to pick, there's just a couple of questions that have come into the chat. So
sorry.
just it's fine. Thanks, Joe. Just because we're running slightly ahead of time, so I think we've got some time to have questions as we go through. We've been asked if there's functionality to search for all of the open projects, and I would encourage people to go on to the members area. Our members area does have a full list of all of the projects. You can now register to let us know that you are planning to take part all of the projects that we've just gone through, and it will be clear on there which ones are open for data collection. You can download the programme, and we will be getting in contact with all of the members to let you know when they're opening, when they're closing, etc. So there's plenty of ways for you to be alerted as to what's open and when. And Joe, just while you're still there and on, we've had, does the adult mental health inpatients include medium, low and high secure wards?
I want to say yes to that question, but Danny, you might tell me otherwise. Danny, are you here?
We will come
He'll
back
respond
to,
in the
yeah,
chat.
we will respond. It could well be that he's responding in the chat already. And the final question was just around the pharmacy prescribing project. That one is currently being scoped. So we don't have the full details yet. We do have a working group. But if you would like to get involved in that, we'd be really welcome and open to suggestions around kind of the scope of that pharmacy pilot that we're running for the first time this year. Okay, so the next few items on the agenda is just around really practically, you know, we've got all of this data in, we provide the outputs back, but how in practice can you get the most out of the data, and how have our members utilised that, and some kind of areas of focus as well around productivity and health inequalities. But I'm going to hand over to Stan first.
Thanks, Emma. Morning, everyone. My name's Stan. I've recognised a few names on the call, but I am a project manager at the NHS Benchmarking Network and primarily work on our acute projects. What we thought might be useful is to give people a bit of an idea, as Emma just touched on, as to how some of our members are actually using the data ultimately. So to give you a bit of an idea of where you might be able to take some of these outputs going forward. What we've tried to do is give you an idea of a few different examples, and there's a sort of a couple of key themes that you'll recognise come out of these examples. The first one here is from Debbie at Ardash, and what she's suggesting is that they've used the benchmarking projects and the outputs from those projects to consider different referral criteria and referral sources in their organisation. So it's giving them an opportunity to sort of evaluate some key areas of their service delivery model, and then implement different approaches afterwards to try and tackle either some of the challenges or to build on maybe some of the benefits they're seeing from already implemented initiatives. I think you'll kind of see that same key theme here in terms of evaluating some key areas of service delivery. So this one's from Ben at Mersey and West Lancashire teaching hospitals. And obviously a slightly different project here looking at ED data, but this is, again has allowed them to inform some service improvement ideas. An example they've given there is improving handover delays. And this sort of data that they get out of it not only sort of improves that service delivery, but they can also use some of the other metrics to start supporting business cases where they think they need a little bit of extra support. The example that Ben's given here is they looked at the length of time spent in ED, and if they feel that this metric for them is much lower than they want it to be, they can take this to different places within the organisation to build a business case to ask for that extra support, either staffing or another resource of some sort. And I suppose then on the same topic as developing business cases, you can see another example here from Helen at the Midlands Partnership. And what they've done is use some of the data again to support a business case. Again, in this case, slightly different. So they've seen that they were light on their senior nurses, band 7 and above. Again, when comparing to other organisations, you're able to see where you lie within the nation or the particular body of organisations that have submitted to that project, and they recognise they were slightly low on their band 7 and above nurses, and so again able to take this forward to different places within the organisation and show evidence-based examples of where they might need some extra support to be able to achieve either the care or the efficiency that they wish within their service. Helen here suggests that they took this to their execs, and then additional funding was agreed ultimately, and the roles that have then been introduced to the teams are already supporting with that retention of staff, and I imagine the care of the patients as well. So there's a few examples there from different providers, and if anybody has any others, then do get in touch. We do have a range of others, and if people want to know exactly how these business cases were built and things, we can support with getting in touch with different people as well. What we also thought might be useful is for our non-provider attendees at this event to have a look at how the ICBs are using some of the data as well. This one here is from John at the recovery programme for Lincolnshire ICB, and he said that there were some real tangible benefits gained from being part of the NHS benchmarking network, and not only being part of that network and obviously those provider organisations within the ICB that they can connect with, but also using the data and the analytical tools that we have available, which ultimately can help shape the thinking of different organisations so they can recognise where there's either inefficiencies or challenges within their provider organisations, and it gives them then that identification of where there might be efficiency opportunities lying within some of the data. So there's a range of tools and data available for different types of organisations that are taking part in the projects and are accessing the network. So if anybody has any questions or any other ideas with how they might have used some of the data, then please do get in touch. But we thought showing you a few of these might start to spark some thinking within your own organisations as well. I think that's me done with these ones, and I'm going to hand over to Alison, who's going to look at how can our data be used to evaluate productivity within your organisations.
Thanks, Dan. Morning, everyone. Alison Worden, managers here at NHS Benchmarking, and I work at Children Services. And I'm just going to speak a little bit this morning about productivity, which is such a hot topic at the minute, and we really wanted to give some suggestions how benchmarking data can be part of this productivity conversation. Can you hear me any better now? Okay. So I've just put together a few examples, and just to caveat straight from the beginning, these are sort of from my work on the children and young people's mental health mainly. So they are a little bit mental health focused, so they might not apply in quite the same way for acute and community providers, but they're just examples basically, just ideas of how the benchmarking data can inform part of that productivity conversation. And what I would say is that, you know, no one single metric is going to answer that question. No one single metric is going to be able to solve the productivity issue, but looking at several metrics together can really help you triangulate the data and give you an area to look into further. So the first example on there is if you were to look at referrals, caseloads and discharges, all benchmarked by your population. So in community mental health services, we benchmark by 100,000 population. If the service happened to be placing higher on the caseload, so had a relatively high caseload, but relatively low referrals and relatively low discharges, that could suggest potentially issues with patient flow, and that maybe by increasing discharges, getting some long stay patients off caseload, that could free up some capacity in the service. So looking at metrics in comparison to each other kind of can give an idea of somewhere to go investigate. It's not itself going to give the solution straight away, but it can give an indication of an area to go investigate. The second example is around inpatient services, so looking at bed occupancy, average length of stay and length of stay profiles. So these are really important metrics to look at together. And if, for example, a high proportion of bed days were occupied by patients admitted for over 90 days, this could suggest, again, issues with discharge. And that might give an indication that discharge pathways could be improved and that could free up some bed capacity. Final example at the bottom there is looking at whole time equivalent staff and contacts delivered per whole time equivalent per day. Now, this is our most pure productivity measure, if you like, because that is the clearest input versus output sort of metric. And contacts delivered per whole time equivalent per day is really key. I think looking at that in comparison with the overall contacts delivered per 100,000 population and the overall whole time equivalent staff per 100,000 population, again, helps you triangulate those different things and inform what might be an avenue to go look at. So if a service had a low contacts delivered per whole time equivalent per day, that might suggest that there is the capacity to deliver more contacts to patients without necessarily recruiting more staff. So they are just a few ideas of how looking at a few metrics together can inform a conversation or inform an area to be investigated further. Now, on here is just a few benefits from looking at productivity measures. I'm sure these are fairly familiar to you all, but they can be really important for meeting national targets and priorities, for supporting operational and strategic decision making. So it's not just about productivity, but the benchmarking metrics can be really key in terms of service planning, workforce planning, and understanding that capacity and patient flow and patient pathways for service design. Improving patient outcomes, at the end of the day, we have a lot of quality measures, and it's really important to look at those as well when we're thinking about service delivery. Driving continuous improvement, which is the aim of all our benchmarking work. Resource allocation and workforce planning, as I've just mentioned, and then identifying efficiency and best practices. So the last slide I've got here is just about how we've done some work supporting our members specifically around the productivity theme. So as you're probably aware, and I think is going to be mentioned later, so I'm jumping the gun slightly, we do have an insight package where members can get an insight membership where we will give some additional support on a theme of their choosing and do some additional work sort of interpreting the data and producing additional outputs for them, whether that be like a report or a presentation or briefing to their service. Now, we've done a couple of these on the theme of productivity specifically already. It's a very popular choice. So if anyone is interested in having a productivity kind of insight package theme, then please do get in touch. We'd be happy to discuss that with you. But on the bottom there is just some examples of the kind of charts that are involved in that bespoke work. So we kind of take it a little bit further than we do in our online toolkits and have scatter plots, and we can look at metrics in correlation with each other and see if there are patterns and correlations between them. So I think that one, and it's very small on my screen, so I can't quite see it. I think that one is looking at the average contacts delivered per WT per day, and the other metric is the ratio of face-to-face versus non-face-to-face contacts. And perhaps unsurprisingly, there is a relationship between those two things. So the higher the proportion of non-face-to-face contacts, the more contacts can be delivered, and the greater face-to-face, the less contacts are being delivered per whole time equivalent per day. So that is just an example of how we have done some work supporting our members around this productivity theme. But if anyone would like to get in touch and discuss that further, we'd be really happy to have that conversation with you. And I think as part of our new I'm just getting onto that. As Emma's helpfully put in the chat, we will be bringing together productivity related metrics in our toolkits going forward, so that there is really a one-stop shop for all the indicators that can help inform that conversation and contribute towards that work that's going on already in all our member organisations. Okay, and that's me done. So I think I'm going to pass to Mark next.
Yep, great. Thank you, Alison. Good morning, everyone. My name is Mark Petrovics, and I'm one of the project managers here at the network on the member program team. And today I'm going to do a quick overview and talk about how our data can be used to evaluate and address health inequalities, as this continues to be an increasingly important issue across the healthcare system, and our work here aims to provide insights and can help support our members to tackle these disparities. So here, basically, I just want to do a quick introduction. What are the health inequalities that we look at? And these 5 key points were taken from the King Fund's website as what they've defined as health inequalities. So the first one being around a person's health status, which could be linked to inequalities of life expectancy. And one of the most common summaries to measure these circumstances across the population is through deprivation. The second is access to service, which can be measured in terms of service availability and uptake. So for instance, more deprived areas tend to have fewer GPs per head and lower rates of admissions to elective care than less deprived areas. Thirdly, another measure we could be around the quality of care that patients receive and what the patient experience might be and their level of satisfaction. There are some behavioral risks to patients' health as well, from an example such as the level of smoking rates. And lastly, there's also sort of that wider determinant on health inequalities when it comes to income, housing, environment, transport, education, and work. So aligned with these inequalities, our data is available through two key sources to measure these that I've wanted to kind of talk about today. And one is around our annual collection in the members program. And this provides sort of that comprehensive data set collected across organizations and covers most of these key points, as you can see. And secondly, the tool that I wanted to point out is our National Indicators tool, which provides our members a large set of the metrics that was mentioned earlier. It allows for benchmarking, which helps our members track key health inequality metrics over time, and it actually covers all of these key points. So here I wanted to share a survey result from the NHS providers where Trust were asked, what are the greatest barriers to your board's ability to proactively address health inequalities? And as you can see, the second and third highest responses were centered around the availability of data to understand health inequalities and availability of data to understand data in the wider system as their greatest barriers. So with close to 50% of responses received confirming that with the support of data, boards could do more work proactively to tackle healthcare inequalities. And this is just evidence that there is a clear gap in terms of the lack of data that proactively starts looking at ways for boards to support planning, an area where we as the benchmarking network can step in and support organizations. Also wanted to share a statement from the NHS providers where it is mentioned that disaggregated data on deprivation and ethnicity, as well as the support to analyze this data effectively, would in fact better equip them to address health inequalities with their trust in the wider system. And as mentioned here, it's not really about looking at some of the complex analysis, but just rather looking at the accessibility of the data that is accurate and reliable, which would help enable to reduce those health inequalities. So again, it's really about having the ability to be proactive in addressing health inequalities so that trust can enhance patient outcomes, improve that service efficiency, and also meet regulatory expectations. And again, having that ability to identify disparities at early on stages with the right data, trust can implement those targeted interventions, which can reduce hospital admissions, potentially improve access to care, and ensure equitable treatment for all patient groups. I mentioned earlier the two tools that we can use here at the network. So I just wanted to quickly walk through the national indicators. So this tool draws from a range of publicly available data sources on several key indicators. It looks at a wide range of data sets, providing over 800 metrics to our members, not all looking at health inequalities, but it could potentially identify healthcare inequalities within organizations, as well as looking at opportunities. And just to give a few examples of what we house here, and this again is not the full list, but we look at life expectancy inequalities, cough prevalences within different chronic diseases and learning disabilities, lifestyle indicators measuring adult obesity, smoking status at the time of delivery, mental health disorders, and also several socioeconomic factors around employment, housing, and alcohol-related conditions. So a great thing about the indicators tool is that it houses several years worth of data, which can provide our members the option to view how the metrics have developed over time. And also that data can be manipulated in several ways, having the ability to view at ICB, CCG, or local authority level, or even using the nearest neighborhood comparator. So members can also add secondary data sets in a number of different ways, including the option to, for example, add ethnicity data, providing the opportunity to identify whether positive or negative correlations exist between accessibility of service in a given region for a specific group of people. And next, we also look at collecting data in our annual project. So around ethnicity profiles, gender, age of service users, neurodevelopment. And for example, in our intermediate care project, we collect service user characteristics in our clinical case reviews around gender, ethnicity, age, normal living arrangements, which could be further supported by looking at referral sources, reasons for admission, cognitive impairment, just to name a few. And this could allow for that comparative analysis across different demographic groups by breaking down outcomes by relevant characteristics such as ethnicity, gender, age, again, the deprivation level, and health condition, identifying disparities in access. We also publish several outputs, including our bespoke reports detailing our findings on healthcare inequalities, along with our online toolkit that can allow members to view several of our data sets, being able to peer group as well as benchmark. So essentially, the data that we collect in our annual projects could be used by drawing conclusions broken down by relevant characteristics and looking at outcome measures compared across different groups to determine whether a healthcare inequality exists. So in a nutshell, lastly, our members can benefit from this data by identifying disparities, comparing that patient outcome, access, and satisfaction of the patient across different demographics, whether that be race, socioeconomical status, or geography, identifying which groups experience higher rates of disease, lower access to care, or worsening health outcomes. Again, targeted intervention using our benchmarking to pinpoint specific areas that would require improvements. So examples would be lower cancer screening rates in specific populations, and potentially designing that sort of culturally tailored interventions, looking at resource allocation, comparing whether the resources being distributed between similar healthcare organizations are relevant, and ensuring that funding, staffing, as well as facilities are equitable and they're distributed to under-reserved areas. And one thing that we do quite well that we're proud of here is, of course, best practice sharing here at the network. So learning from other organizations that are excelling in reducing some of these disparities and potentially adopting some of their strategies. So connecting you guys to different members, implementing models for preventive care, chronic disease management, and looking at policy process improvements, as well as workforce diversity and training. So again, lots of great ways that we can support organizations with developing their healthcare inequality strategic planning and supporting alignment towards achieving those objectives to reduce healthcare inequalities. So that's my spiel on healthcare inequalities in a nutshell. If there's any questions, we're happy to take them on. But I think I'm passing it back to Rosie now for events.
Thanks, Mark. Yeah, but really interesting. I will now just cover what we're planning on doing with our event programme for the 25-26 membership cycle. Again, we had lots of feedback from our members this year on what worked really well with the events that we offered, and did a bit of a deep dive with some of our members to kind of really get under the skin of what you're hoping to get from the events that we offer. For those that are maybe slightly less familiar with the work that we do for our annual data collection projects, what we offer at the end is, as Joe has already covered, we have the kind of the member reports, we have the toolkits. I've just posted a link on the chat that'll help you kind of navigate the toolkits and some videos that we are able to use. And the on those toolkits, you can then do the code sharing and things like that as well to identify peers. I could see the conversation happening between Joe and Liz. Obviously, that the National Indicators tool does allow you to kind of identify others anyway. That's kind of publicly available data, but within the projects as well, if you're wanting to look for your nearest neighbour, you can use that code sharing if your organisation has consented to it. But what we also do to help you digest the information, because we realise our toolkits have such a wealth of information available, is we offer an event programme. Within the event programme for last year, we did our kind of standard findings events, and we could see lots of people on the call I recognise attended those. But what we've done with that evaluation, that member feedback, we've kind of rethought our event programme for this year. So we've kind of broken it down into two types of events. So we will have the traditional benchmarking findings webinars, as you can see on the right-hand side, for some of our projects. So again, that will cover kind of the key findings from the data collections, that kind of shared learning, the guest speakers that we've had over the years that have been really valuable and insightful. If anyone does want to see any of the previous events that we've hosted, you can find the recordings on the members area. If you click onto events and click at the top, you can toggle back to past events. You'll find the recordings and the slides there, where the recording and slides for this event will also be. We also have recently seen that kind of networking and the Q&A opportunities that have come through those findings events, and so we plan to build on that again this year. So if anyone does have any suggestions on what they found really useful in our findings events, please do let us know. What you'll have seen for those who've joined us recently, we've also started to develop our Lunch and Learn webinars. So these are maybe potentially more focused events where not only will we share some data, but we will also invite kind of guest speakers and really focus in on a certain topic. Some of the feedback that we had was about the relevancy of the whole event. And so this can help us really kind of hone in on key topics and challenges that are facing the different sectors that we benchmark. So as you can see, and as I've alluded to, we would dive into a key topic or theme, help you understand how to get the most out of your data on that theme, and then facilitate that discussion and networking. So you can connect with other people who are also striving to improve in a certain area or are finding a certain challenge within their organisational system. So our events kind of take place towards the end of the cycle. So you'll have your report, you'll be able to digest the information of kind of what's happening for your organisation, and then you can come into the event and try and network and learn from others. And so we plan to really kind of build on that this year. In terms of how we're planning to split the projects, with the Lunch and Learn versus the benchmarking findings webinars, you can see it on the screen, and I won't read it out right now, but you can see kind of the approach we'll take for different areas. And this is due to kind of the nature of the kind of content that are in those projects and how those projects should be delivered. As it does note at the bottom of the Lunch and Learn webinars column, for those that we are doing the kind of more Lunch and Learn kind of interactive sessions, we do plan as well to do kind of videos of a summary of the findings. So you can still do that digest, that moment, that reflect, but also kind of then come along and meet these shared learning speakers and really hone in on some of those topics. So the events will be going in diaries as and when those dates are decided. So please keep an eye out for that. Please check the events page, which we can link in the chat as well. But yes, I look forward to kind of engaging with you in our event programme for this year. So now I will hand over to David, our product designer, to talk through some of our tech developments. Thanks, David.
Thanks very much, Rosie, and good morning, everyone. For those of you who haven't seen me before, I'm David. I'm a product designer at the network, so I work between our users, our internal support team, and our development team to specify and design our online systems and our web applications. So in this part of the session, I want to cover some upcoming developments in our technology. So over the last few months, we've presented these development ideas to our reference groups in the network, and I've been working with a group of users from member organizations who have all had and will continue to have input into these developments. So I'm going to talk today mainly about our outputs and introduce a new approach to our toolkits that we're calling the Data Explorer, which aims to be a more user-friendly product whilst also providing more insightful outputs. But I'll also touch on some of the wider developments that are aimed at reducing data burden in the future as well. So first of all, some history briefly. The members area has been around now for nearly a decade. 10 years ago, the members area held just a few core projects, as we used to call them, which ran annually. They're the projects that you'll be most familiar with. Our database back then held around 1 million data items, in other words, individual responses to our data collections. But since then, of course, the network has grown enormously, and the members area is now home to over 70 projects of various types. The annual project is still very much at the center of things, but as you've heard from the team already, we now run our monthly and national indicators projects. We have data from NASAL, one of our audits in there. Many of our projects now include surveys collecting data anonymously at a patient and staff level, and there's also many other bespoke projects. What that has resulted in is us now having more than 15 million data items in the database, and of course we expect this to just keep growing. In other words, a lot has changed in the last 10 years, and it's time for us to bring something new to members above and beyond the year-on-year incremental changes that we make. So that brings us on to the future developments. So as a company, we've made the decision to invest in a new single product and a code base that can replace our current systems, and that includes our members area. So this will allow us to adopt more modern technologies from the outset. It'll also allow us to be more flexible in the data we hold, which has become and is sort of siloed within programs and individual projects at the moment. Alison talked before about bringing metrics together in terms of productivity, which we're already starting, but this development will allow us to pull data from multiple projects, particular area or theme. From a design perspective, we want to, again, learn from our experiences, but also reduce complexity wherever we can and develop a more modern and user-friendly interface. As I mentioned earlier, we've been working with, and we will continue to work with, our reference groups, our user groups, and our own internal support team who use these products on a day-to-day basis to gather requirements and create the best possible system. As I'm sure you can appreciate, this is a significant development for us, so we have broken it down so that we can approach it in a modular way. I'm going to focus today on one of those modules, as I said, and that's the Data Explorer. So the Data Explorer is an evolution of our toolkits, again, bringing together all of the learning from many years of development to give the best possible experience in terms of gaining insight from our benchmarking data. The purpose is simply to show the analysed data from our projects, of course. It includes various views, dashboards, overviews, detailed Explorer views, but the primary aims are for it to be easy to navigate in terms of structure so that anyone who wants to understand and use the data can do so, regardless of analytical skills and experience. So I'm going to talk and show you 3 views in the Data Explorer now. These are final static designs that have been created for our development team who are working on building it as we speak. So there's the landing view showing the content of the Data Explorer, a sort of high-level categorization of the outputs, the overview, which shows summarized views of multiple metrics in a group, and then there's a detailed view which shows all of the data for a particular metric. So I'll show you these now. So this is the landing page. I'll start by pointing out the navigation bars at the top of the screen that you're seeing here, which give an idea of the general members area redevelopment. You can see that we are within the district nursing project, and the whole flow of the project is set out in a single view. So from details there on the left and registration through to the Data Explorer. You can see that we're within the Data Explorer tab, and you can see below that there's the high level structure of the outputs in the cards, so baseline, service model, etc. This is mirrored on the left hand side in the sidebar, which will probably be familiar to you if you've used our toolkits before, but the difference is that the tier structure is limited to the levels that you see here, so they'll only go down as far as a group of metrics, so it'll be easier to navigate to an area of interest and see the data. So for example, if I was to click on referrals here on the left hand side, that takes us to the overview page. So this is the overview page showing multiple metrics within the referrals group. You can see that there's a summarized version of the data for each of the metrics showing your selected submissions position versus the sample median and the overall range of data, familiar to you if you've seen our reports. Of course, these charts that you're seeing here will vary depending on the type of data that we're showing. But on every group, you can see that there's a list of metrics in the group on the right hand side, with the option to select only those you are interested in via the checkboxes. So these views will also be printable or exportable to PDF, so that once you have the page showing the metrics you're interested in through those checkboxes, it's easy to export and use offline, so to speak. You can choose to add comparisons via the Compare Data button at the top. So this will allow you to select a peer group, which will then be added to the view for sort of side-by-side comparisons. When you hover over one of the tiles, some additional options come up. So the grey bar under the top metric, you can choose to export the data for that metric or export the tile as an image, again to use in presentations. You can view metadata for the metric, so in other words, details of what the metric is and how it was calculated. And the final option is to explore the metric in more detail. So clicking on Explore takes us to the detail view, as we're calling it. Now, this is the view that's probably most like our existing toolkit, so hopefully it's familiar to you. It simply shows all the benchmark data for the selected metrics with your submission or submissions highlighted. We've made it easier to switch between the various visualizations of the data. So in this instance, there's a column and bar chart view and a full data table. And we've made the key values, so things like the sample averages and the submission values, more prominent, including values for any peer group that you have selected. In this case, we're showing a regional peer group, which is also highlighted on the chart itself. You can see that the navigation and options have all remained above the chart, so you can still navigate to another part of the Data Explorer. You can add your peer group comparisons, and you can quickly move between metrics in the group. So that's a really quick look at the new Data Explorer. I'm really grateful to all of those who have taken part in our user group sessions so far and provided feedback. I can see that there are a few on the call, which is great. We think that these developments are a big step forward in how we provide you with the best insights into your data, and we're really looking forward to sharing them with you. In terms of rollout, in 2025, we'll still release the data initially in our existing toolkit, so there's continuity with previous years, but we will give you access to the new data explorers for each of the projects as soon as possible after we've released it on the current members area. And we will then continue the transition into 2026, so that from 2026 onwards, everything will be in the new system. We will, of course, be providing demos and guides on how to access and use the new data explorers when they become available. And I've added here that if you are interested in helping us to test the new system and you want to get slightly earlier access as a tester, or if you'd just like to join our user groups, which are still ongoing, we would love to hear from you. So please do contact the support team. Of course, the Data Explorer is only one part of this development. There are other modules that we're working on for the full transition in 2026, and I just wanted to highlight 3 of them here. So the user portal is what wraps around everything, controlling access and allowing you to get into each of the projects that the member program has to offer. It's basically the redevelopment of our members area as we know it now. In terms of data collection, we're working on ways to reduce data burden wherever we can and make things as streamlined as possible. This was the topic of our latest user group, and there were some fantastic ideas that we're looking to implement for 2026 to make things as easy as possible in terms of providing us with the data. We appreciate that it is a massive job. And finally, in terms of validation, we've made some really good progress actually in this area in the last couple of years, but again, we're looking to make this as streamlined, as insightful as we possibly can. The quality of our data is hugely important to us at the network. Data excellence is part of our vision, and we know it's something that is valued by members as well. So it's really important to us that we keep developing in this area. Thank you very much for listening. I hope this has given you an idea of where our technology is heading over the next 12 months. We're really excited to get these developments out to you. And I'll hand back to Emma.
Brilliant. Thanks, David. Yeah, we're all really excited about the technology and the opportunities that that is going to bring, both internally in terms of how efficient we can be and the kind of types of insight we can provide back, but also for you, our members, in terms of how you can better interact and utilise the insight. So thank you to those of you that have already volunteered to use a test. We've got some willing volunteers already, David, which is amazing.
Great to hear.
Brilliant. We have had some questions in the chat as we've been going through, which I think we have addressed most of them, but there will be some opportunity in 5 minutes or so just to open up to questions. So if you do have any about anything that we've been through so far in the session, please do start to pop those in, and we can spend the last few minutes or so going through those. But I just wanted to finish off really just talking a little bit about our insight and bespoke work that we offer here at the NHS Benchmarking Network. As we've talked about sort of all through the session this morning, we've been doing this for a long time. We've got a whole host of information in the site, kind of networks, support from our members, and as our membership offer has developed, so has kind of the additional requests that have come in from members to kind of support more with additional pieces of work, or just to support in terms of kind of that additional interpretation of the findings from those member projects. And so therefore we've started to provide additional pieces of work, whether that be at kind of individual service or organisation level, or whether that be at system or regional level. And we do have some opportunities in terms of gaining additional insight, either through our Insight membership or through bespoke pieces of work. So just wanted to finish on that. So we do offer an Insight membership, which is an upgrade to your kind of foundation membership, and just provides you with some additional support from the network team to kind of digest and interpret your data and really enable you to understand and unlock the so what. If you're interested in that, please get in contact with the team to find out more. We have popped some examples on the slides of the types of things that we've done so far for our Insight members, and the work that Alison mentioned earlier around productivity has been developed as part of our Insight membership as well. But you can really utilise this flexibly to kind of unlock kind of solutions to problems, etc., and just understand more about the data and insight as part of the annual and monthly projects. In addition to that, we do have kind of larger bespoke opportunities as well. These can take many forms, but often just build on the insight that we've collected, developed, provided over the last 30 years and kind of utilise either the member data sets or kind of our tried and tested model of benchmarking and technology alongside additional data sources to support identification of solutions to a particular problem, things like kind of dashboards, mapping tools, kind of deep dives into project data. And just some examples of things we've worked on recently have been baselining community mental health services, following an organisational merger to support understanding of how those services were operating and kind of bringing the best together. But also recently done some capacity and demand analysis across provider collaboratives. So kind of the options are endless really with some of this, but if there is anything that we can support you with, please get in contact to find out a little bit more. So that does really bring us to the end of the session this morning. I will open up to questions. There's been a lot of information given. I'm aware that it's been probably a lot to take in. It's quite hard to get into the detail of everything that we offer in an hour and a half, but hopefully this has given you a bit of an overview in terms of what is available as part of our member programme as we go into 2025-26. If you are a member, please get in contact with your member contact. If you're not sure who that is, pop us an email. We'll pop the email again in the chat. Or if you're not a member and would like to look at joining, again, please do get in contact with us. So I'm going to open up to any questions. I think we've just had one around the slides and the recording, and absolutely that will be available in the members area, hopefully in the next couple of days. And again, if you need access to our members area and you haven't yet got a login, you can do so by requesting one from the login page, and we can get one set up for you. If you are from a member organisation, there's no limits to the number of logins that you can have, and that does give you access to everything that we've talked through this morning. So I think we've covered all of the questions that have come through in the chat. We will do a little double check this morning, and if there is anything that we've not covered or boxed off, we will get back to you. But we have got 10 minutes, so if anyone does have any questions, please pop them in the chat or feel free to raise your hand and we can take you off mute if you'd like to ask a question in person. Everyone's quiet. We've bamboozled everyone into silence this morning. Okay, we've got a question from Karen. Let's just, you should be able to take yourself off mute, Karen.
Yes, got it. Hi everyone. Yes, so it's about timeliness of access to data, and I know it's not within your control, but I wondered if there's a way of perhaps conveying it on your platforms that, you know, I don't know, it was last checked last month and the data was unavailable, or when the data is expected to be available would be good if you can even get hold of that. I don't know, I just think that would, because I quite often go onto the ED data, which I find quite useful, as you know. But and I know that is outside of your control, but some feedback, if you've got access to that kind of information, would help.
Yeah, absolutely, Karen. So are you alluding to the national indicators and the acute indicators with the national data that we're pulling in
Yes.
particular?
Yes.
Absolutely. So we have added some more information onto the kind of home landing page of the national indicators, just to give a little bit more detail of kind of when things were last refreshed, or anything that we've had to retire because that data isn't available anymore. But we can absolutely make sure that we're doing that across the board. And as you've done previously, Karen, we're really interested to hear if there are any metrics that we're now not able to get nationally that have been retired but have been particularly interesting. If you can let us know, because we can then look to add those into our data collections. So that's been really helpful, the feedback we've had so far.
Will do. Thank you.
Brilliant, thank you. Okay, I think we've got another hand. Morning.
Hi, morning. Ailish Graham, pharmacist in Cambridge. I'm going to be leading the data collection for our survey this year, and I've just logged on. I see the questions are available. Do you send out some form of Excel version of this to us, or when should we expect that, so that I can start collecting with my teams?
Brilliant question, thank you. So yes, all of our projects are now open for registration. Data collection will kind of be staggered now from sort of April onwards, and we will get in contact to let you know when data collection is open. Prior to data collection opening, we will send the specifications out as an Excel document, and we will pop them onto the members area portal as well for you to download too. And throughout the data collection period, we will offer drop-in sessions for members as well. So if there's something you're struggling with, or you're struggling to interpret a metric, or you just want some more support, you can get in contact with us by email or phone, but we will have those kind of drop-in sessions as well available throughout the data collection process.
That's brilliant. Thank you very much.
Fantastic. I think if we've got Joe. Hopefully you can take yourself off mute. Morning.
I can. Morning. You're right, Emma.
Yeah, good, thank you. Are you?
I'm very well, thank you. Mine's just a very quick one on the concise member programme that you published that's got all the dates, you know, of the collections and the reports and the findings. Is there likely to be some kind of timetable work programme on some of the ad hoc projects? Because there's quite a lot of workforcey ones that tend to sort of come around every year, and it would be nice to sort of see when you maybe aim to be collecting those so that I can sort of figure it in the work programme.
Yeah, absolutely. I do appreciate that some of the other programmes of work are also open to
yes, we do quite a few of those
members.
Yeah.
Yeah, absolutely. As soon as we have those dates available, we will absolutely communicate those with you. The workforce programme is commissioned by NHS England, so we're just waiting for those dates to come through from them. And as soon as we have them, we will let everybody know.
But do you anticipate the usual ones to come out, like perinatal and psychological services and IAPT and talking therapies and all that kind of thing?
Again, we're just working through the scope of them. In terms of adults and older people and children and young people, we will be running the workforce collection alongside the members collection and collecting it together. So where we can, we will reduce that burden by kind of collecting it once, essentially. So yeah, as soon as we have more information, we'll let you know.
Much appreciated. Thank you, Emma.
Brilliant. Any other questions? I can't see any other hands. Oh, Christian.
Yeah, good morning. Thanks for the presentation, and it looks really good, and the Data Explorer looks great. So I've got a specific ask really on, and that's particularly related to finance. So is it possible in the Explorer to see what the opportunities would be if we were operating at like the mean or the medium level in terms of financial value? So, for example, if we're well over the national average for cost per contact, if we were at the actual cost per contact for our level of activity, what would that opportunity be in a pound note? Previously, I've taken the data out of the toolkit and calculated it myself, but it'd be great if that was in there just as a kind of a headline kind of number. So that's just a bit of an ask, really.
That's brilliant. Yeah, we're, like I said earlier, we're really keen to get feedback, and we want this to be useful for members on the ground. So absolutely, we can look at how we can bring that into our reporting, whether that be through the reports or the Data Explorer. But yeah, thank you, Christian. That's really helpful.
Thank you.
Fantastic. I'm just going to stop sharing so that I can see the screen. I can't see any other hands up. I can see a couple of comments in the chat there. That's really helpful. Thank you. So if we haven't got any further questions, I'm going to give everyone 4 minutes back. Hopefully you can go and grab a drink before you dive into the next meeting. But thanks so much, everyone, for joining us this morning, and we really look forward to working with you throughout this year. Thanks, everyone.